Heart valve repair has many advantages. If the valve is repaired, we are able to retain one's own natural heart valve. That gives us the freedom to do anything naturally. It is natural, it's normal, and the repair can last a lifetime. There is no need for any post-operative medicines. There is no need for any blood thinning medicines. For a pregnant woman, that is very advantageous. Normally, blood thinning medicines that need to be taken every day and monitored regularly need very meticulous adherence to a strict treatment protocol. These medicines also can cause birth defects in pregnant women. So, for all practical purposes, we actually need to stop these anticoagulation medicines for at least 6 months out of the 9 months of pregnancy. When these medicines are stopped, they are replaced with injections twice or thrice a day. In a country like ours, this can prove to be very expensive. So, heart valve repair actually allows a woman to have an absolutely normal delivery without any medicines, without any fear, just like any other normal woman.